Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India. This video contains an operative procedure meant for eye surgeons for education purposes. Viewer discretion is strongly recommended. So this patient was very apprehensive, and the moment I tried to make a side port, the whole head was moved. So in such cases, it's always better to give some sort of a block. So here I am giving a subtenon's block in the inferonasal quadrant with the help of a 26 gauge needle, and after waiting for 30 seconds you can see that now the patient is very comfortable and is now able to fix the gaze. So in such apprehensive patients, it's always better to make them comfortable, either give them a subtenon's block or a peribulbar block, but make sure that the surgeon comfort and patient comfort is utmost important for a good result of the surgery. So now once the patient is comfortable, I am able to do all the maneuvers easily. So now with the help of this Utrata forceps, a 5.5 mm of Rexis is being attempted. So this is a NS2 grade cataract, not very hard. But in this case, I found it difficult to bring the pieces up and out of the bag to emulsify. So how I managed, we'll be seeing next. So now going underneath the anterior capsular rim, gently tenting up the capsule and then injecting BSS. Same procedure again. We can see a good wave going through, and then the nucleus is partially dialed. Just to confirm, we will be rotating it again with the help of a dialer, and now it's rotating comfortably. So now the probe of cataracts 3 phaco machine is introduced. The superficial cortex is removed, and then the bevel is turned up. The karate chopper is then introduced. Now the probe is buried in the subincisional area and moves towards the center. And once we get a good hold, the karate chopper goes to the periphery, and we've got a decent crack. Now this heminucleus is again divided into two halves. It's done easily, but the moment I try and divide this second heminucleus, see what happens. The hold is good, but suddenly there is a punch out. I was lucky that the probe did not hit the posterior capsule. So now I am avoiding holding the nucleus, but see again there is a punch out. So now I am trying to mechanically divide these remaining quadrants. Now trying to lift this piece up, I was unable to do so. Now I am sure that this quadrant is free, so I have tried to lift it up and it comes out, and I am able to emulsify this one quadrant. Now in this remaining part of the nucleus, I am not exactly sure whether I have got complete cracks or not. So instead of fishing in the nucleus and risking another punch out, it's better to come out. So in such cases, now we can either hydrodissect again, or we can viscodissect, or there is another option. Go in with the dialer and lift one or two pieces up. Once these few pieces are up, it gets easy to manage the nucleus. And now again going in with the probe after coating the endothelium nicely. And these pieces emulsify. The remaining nucleus is then lifted up. Now I have a dialer in my hand, and moment one pole comes out, the whole remaining nucleus flips out, and then it's easily emulsified. So there is no strict dictum that once you are in with the probe, you have to complete the whole phacoemulsification part. You need to adapt as per the situation. So here I felt it was wiser to take help of some other method or some other instruments, and that worked pretty nicely. Now the cortex is being cleaned by a 22 gauge Simcoe cannula. Now to clean the subincisional cortex, it's always better to go through the side port. The chamber deepens and the accessibility is better, and in no time the cortex is managed. Some amount of OVD is injected to fill the bag, and the wound assisted injection of the IOL is done. But look carefully, the leading haptic just slips out of the bag. So now we need to dial both these haptics inside the bag. So first the trailing haptic is dialed in. The leading haptic is then again dialed back in the 12 o'clock position and then goes in the bag. So once the IOL is in the bag, a thorough visco wash is done, both from above and behind the IOL. So the take home message is, you need to judge the situation and act accordingly. So that's it. The Rexis is nicely covering the optics, so the stability will be great.